Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the indications for spinal discectomy surgery for sciatica. Sciatica occurs in 1 to 2% of the population at any one point in time, and most people have no clue what they did as an inciting event. Usually it's due to a slow disc degeneration that results in a tear with the inner part of the disc squeezing out. You can see in this cartoon an example of here's a disc and then a piece has squeezed out and it's pinching on the adjacent nerve root. The symptoms of sciatica is that it results in a pinched or irritated nerve root that gets inflamed and causes leg pain, maybe a burning sensation, pins and needles sensation, possibly some numbness, maybe some weakness, and rarely incontinence. That's a surgical emergency. Initial treatment for sciatica should consist of a short period of bed rest, no more than 48 hours, over-the-counter medications such as anti-inflammatories and Tylenol, physical therapy, chiropractic, spinal decompression therapy possibly, and then there are prescription medications, Medrol dose pack, narcotics, muscle relaxers, neuropathic medications such as Lyrica and Neurontin, and then there's interventional treatments, the gold standard of which is epidural injections. Trigger point injections can help with muscle spasms. There are 3 types of indications for sciatica surgery. One is absolute, meaning you have to have it, no ifs, ands, or buts. Relative indication is one where you should start to consider thinking about it. I'll explain that. And then quality of life means you just don't have to have it, and it's something that's elective. All right, so absolute means you have cauda equina syndrome. What you can see here in this cartoon is that a large amount of the inner jelly, the nucleus pulposus, has squeezed out and is pinching on the end of the spinal cord. That's called the cauda equina. Okay? So what happens is it can be such a large amount of compression that it can start to cause incontinence of bowel and bladder, and if it's not treated emergently, it can become irreversible. Okay? So studies show you should have treatment within 24 hours of removal of this disc. It's pushing on that in order to make sure that there's not permanent disability. Now, relative indication, the best example is motor weakness. So if a nerve's getting pinched, it can result in, depends on which nerve of course, but it may result in a foot drop where you can't lift up your foot. That's most commonly the L5 nerve root being pinched. Now, this could be watched for a while, but the question is, if you watch it too long, it may never get better, even with a technically perfect surgery. Okay? So it should only be watched for possibly 6 weeks, no more than 12, but there's no hard black and white time frame. All right? Especially if it's getting worse, the weakness is getting worse, that's a higher indication, higher relative indication for surgery. The next is elective quality of life procedures. Now, if you're just dealing with pain and numbness, that in and of itself doesn't mean you have to have surgery, but if it's not getting better with considerable conservative treatment over 6 weeks, then consideration should be given to having a procedure. Now, as we mentioned, there's medications, PT, chiro, here's spinal decompression therapy, injections. If just none of those are helping and it's been a couple months, 3 months, then it may be best to consider having a procedure. Well, what are the outcomes of sciatica surgery? Overall, less than 10% will need to have any procedure done. Over 90% good to excellent results occur with a discectomy procedure. There was a landmark study in the Journal of American Medical Association in 2006 that showed that whether or not you have surgery, it's identical outcomes at the 1-year point. That's excluding the motor weakness and the cauda equina syndrome. Surgery did help increase mobility and decrease pain faster, though. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are multiple clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.